Hello, my name is Robert Sandrock. I'm the director of the AIDS Insurance Continuation Program here at the Health Council of South Florida. Tice was asking me about the culture of our organization here. We are a nonprofit organization here in Miami-Dade County. Our primary focus of work is community health planning, and my program, the AIDS Insurance Continuation Program, is the only program in the company that's really client center focused. So although I'm in the same organization, we are a little different. In terms of our culture, I would say our culture here is pretty informal. We have a president and CEO who oversees the planning division. I oversee the HIV/AIDS division. It's a combination of informal and more formal. Because of our program with AICP, being that we're very client-centered and we have contracts with nonprofit agencies around the state, it's really imperative that we begin at 8:30 in the morning and end our work by 5 o'clock, if not later, in order to be responsive. So my team here really is more structured, more formal in terms of operations and in terms of accountability for their time. It's imperative that we follow those hours of operation with our contract through the health department. The planning department.
The every organization has its own distinct culture. Sometimes that culture has been there for quite a long time. Cultures are also things that are very difficult to change when they're there. If you go about trying to change a culture, it could take years to get it done. When I first started out in healthcare, the first organization I worked for was Jackson. And Jackson, I thought all hospitals had the same culture of Jackson, which was kind of frightening because the culture of Jackson was it was a culture where it was very formal. There were very strict lines of communication with. When I left there, the next job I went into was interesting because it was opening a brand new hospital in Nevada. So it was going into a new building, hiring all new staff, and there was a situation where there was no culture because there was nothing there. So it was created an opportunity for uh, me as the CEO to really establish what the organizational culture was. And when you're when you're in a job as a hospital CEO, you really don't have a plan that says, here's my organizational culture.
So our culture is more patient-centered, and when it comes to patient-centered, our culture is also changing to involve the family members, as it's very important. The needs of the patient and the family are met. So Jackson employees are long-term employees. Average employees have been there approximately 15 years. Therefore, we are definitely in a change culture at this moment, and it's been one that has been well received by the employees, but definitely a culture of change and evolution, and that's already coming to fruition as we've experienced some massive layoffs and right-sizing to ensure that we are competitive, because we also, other than the public mission, we have a mission to the Miami-Dade County residents to ensure that we serve the community with the highest quality of healthcare possible. So Jackson's culture is ever changing right now, and it is a culture that hopefully with the healthcare changes that are coming down the pike, will be able to come out stronger.